بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد الصادق الوعد الأمين. السلام عليكم ورحمة الله وبركاته. My name is Dr. Adla Albabtain, Consultant Obstetric Gynecology, MOH, and Deputy Head of National Training Program Technical Affair. Hello everybody, and welcome to this series of webinars of COVID-19 management, which is conducted by the National Training Project in MOH for different specialties, and the specialty today is psychiatry. We have been having a lot of viewers in the previous webinars, and that have encouraged us to continue in doing these webinars. Our aim is to provide the topics which help our staff and residents during this pandemic and keep them updated. Today, our webinar title is Impact of COVID-19 on Mental Health. As you know, during this pandemic, we have a lot of stresses among the doctors, whether they are resident or staff in different hospitals, especially those who are in the quarantines and in other hospitals. They feel that they are overwhelmed with work, and they feel that their work is not appreciated. And when they go back home, they feel that they are avoided by the family and children because of the they are working in a pandemic area. And those who are in the front line, they have the fear. There is a fear from the healthcare providers, other healthcare providers, and they might have also the thinking all the time that, am I suffering from burnout? Am I suffering from burnout syndrome? So they also have, some of them have inability to cope with all these stresses in such a situation. Also, lack of sleep and unhealthy diet might affect them. So all these factors we are going to discuss during this webinar. And all these queries are going to be answered. The speakers of this webinar is three doctors, Dr. Maryam Al Awadi, and she is a consultant psychiatry, and she is assistant professor in Kuwait University, and she will be the moderator of this webinar. The second speaker is Dr. Ibrahim Al-Mazidi. He is assistant registrar in psychiatry in Kuwait Center for Mental Health. The third speaker is Dr. Husain Alsha. Now, I will move the mic to Dr. Maryam Al Awadi, who is the moderator of this webinar. Thank you very much.
Thank you very much, Dr. Adla. I think الحين it's the floor is mine to start the presentation. واليوم it's a very interesting طبعا topic, because we'll be discussing mental health impact of COVID-19 والفترة هذه اللي احنا يعني عايشينها because of course what's going on with corona and the effect of it specifically on frontline workers اللي will be the main audience of today's presentation. I just want to go back to my slides and okay, I have just دقيقة واحدة. I have to go back to the slides and yeah, okay, so I think تمام. Okay, perfect. Sorry, لأن هذه أول مرة نستخدم مايكروسوفت تيمز، فشوية ال technical part is a bit confusing. My part will be about burnout, okay, in healthcare professionals during COVID-19 era. At the same time, these are very important tips and signs and symptoms for every frontline worker to know about. I'm hoping at the end of this presentation, it will be a useful presentation for people who are currently dealing with patients on a daily basis and are definitely sometimes going through difficult mental health symptoms and are unaware if these are pathological or just normal reaction to what they're going through. Basically, it's always very difficult, okay, for healthcare workers to work in an environment where they feel that they're limited, and the resources are limited, and at the same time they are working in an environment where they feel they're sometimes helpless in helping their patients. And that's what's happening right now with the pandemic. Of course, the normal human mechanism as a defense mechanism to deal with this is that patients usually, frontline workers or doctors usually use coping mechanisms like turning to spirituality, religious beliefs, intellectually trying to accept the situation. But it's very hard sometimes to reach a conclusion where accepting that there is little that could be done, or that we can't save all our patients, okay, is a reality that a lot of people have difficulties accepting. However, reaching that point of acceptance is usually what does help in the sense of mental health, even though it's a very hard point to reach. But I just want to emphasize, and it's one of the most important points we want to aim to. With regards to defining what is burnout, and a lot of people maybe have a confusion with, is burnout the same as depression? Is it the same as adjustment disorder? Is it the same as other psychological disorders that people go through under stress? Actually, burnout is defined as a psychological syndrome that emerges specifically after prolonged response to chronic stressors on the job. So it is very specific to an occupation, to the job we're doing. The three key dimensions that usually are there in burnout include exhaustion, feeling of cynicism and detachment from the job, and the sense of ineffectiveness and lack of accomplishment. Okay, so these three are the three main domains to define burnout, and I'm going to talk more clearly about each one of them. Okay, so exhaustion can be, of course, physical and mental, so not just physical exhaustion. The feeling of cynicism is basically self-criticism and feeling detached from the job that they're doing. And finally, the lack of accomplishment and the inability to feel satisfied with the job they are in. Burnout has been recognized as an occupational hazard mainly in people who are dealing with human services. So not just doctors, of course, even people who are in education and healthcare, and in general, any occupation that deals directly with humans, you could be at risk of burnout, because the relationships that you do develop between the provider and the recipient does actually always require a lot of personal and emotional contact. And even though these relationships can be definitely very rewarding and engaging, and as psychiatrists we know that this is something we experience daily with our patients, it can be quite stressful because it does have an emotional draining side. So we always have to be aware of this, and a lot of these symptoms sometimes can be subconscious and present in different ways that I'll be going into soon, and we don't really relate them to the emotional stress or the emotional impact from such demanding relationships. We know, of course, and that makes a lot of sense, that people in the healthcare profession tend to be at a highest risk with regards to burnout comparing to the general population. It's also reported that the risks are moderate to high, and of course, in times like this that we're living right now, the risk is even higher. In terms of the higher level of burnout, it's usually correlated with negative feelings about patients and even a poorer quality of patient care. And that's probably one of the most important points I want to emphasize, is that this is not only about the healthcare provider, it's also about the patient that they're providing for. And if this is left unattended and untreated, this definitely will impact the relationship that the doctor will provide to their patients. Lack of empathy, lack of engagement, and even probably not the best decisions medically taken due to the fact that the doctors themselves are very drained. So the three dimensions that I mentioned earlier that define burnout include exhaustion, as we mentioned, and it is basically defined as wearing out, loss of energy, depletion, debilitation, and fatigue. And this is not only concise to the physical exhaustion. It also does include mental energy, mental depletion, and even mental fatigue. Cynicism, okay, it's usually used to be called depersonalization, which is basically when a person starts to have negative or inappropriate attitudes towards their patients or clients, and they lose that loss of idealism, and that causes withdrawal. So you lose that empathy, and you lose that ability to engage with your patients, okay, and therefore it's usually presented with irritability, lack of patience with them, and therefore you depersonalize from them. The patient is no longer, let's say, people to you. They are just cases. They are just medical cases without the human, let's say, aspect to it. Inefficacy, this is, as you all know, it basically means the lack of accomplishment, the reduced personal accomplishment. It's usually translated also into reduced productivity or capability, low morale, and eventually the inability to cope. So in burnout, these three domains are usually present, and we need to pay attention to them. Okay, so what is the opposite of burnout? Engagement is usually the positive, let's say, aspect of the relationship between the healthcare provider and the patient, and it also does have three main domains or dimensions. It's basically a state of high energy, which is mental and physical, and the mental energy, I'm talking here about the motivation, the excitement, the strong involvement in the work, and the high sense of self-efficacy. So it's basically the opposite of burnout, and this is usually the ideal situation, okay, that keeps a person engaged in their profession. The main factors that have been studied to be associated with the risk of burnout are the following 6. Number 1, the workload. Number 2, the control you have over your work. Number 3, the reward. Number 4, the community you work in. Number 5, the fairness. And then finally, the values of your work. Okay, and I'm going to go into each one of them quickly to explain how is that associated with burnout. So workload, basically, I think this is common sense. The more you are loaded with work, the less time you have for a break, the less time you have to take care of your own needs, okay, and probably will increase your stress level. And this usually is a chronic condition sometimes to some people because it's continuous on a daily basis in some occupation. It gives you less opportunity to rest, recover, and restore balance in your life. And a sustainable, usually, and manageable workload, in contrast, of course, provides opportunities to people to refine existing skills and to become more effective in their work. So the more you load people with work, okay, the less chances that they will be effective or even to maintain their efficacy at their job. Now, right now with the pandemic, it's definitely one of the problems we are facing, and a lot of frontline workers are facing, is that they are overloaded. Their hours, the number of patients they see, okay, maybe even the number of hospitals they visit. This is an exceptional time where they are overloaded, and it's definitely one of the risk factors to put them at risk of burnout. Number 2 is control. So there's a clear link between lack of control and burnout. Okay. So on the contrary, we know that when employees have perceived the capacity to influence the decision, and that can affect their work, to exercise some autonomy in their work and gain access to resources, that definitely makes them enjoy their job experience and become more engaged. So in situations where you lose control over what you're doing on a daily basis, you can't make decisions. The decisions that are being told for you to do or to follow are not ones that you have control over. This also puts you at risk of burnout. Now, reward is a very, of course, popular and at the same time well-studied phenomena where any behavior which is rewarded tends to reinforce that behavior, right? So when there is insufficient recognition and reward, whether it was financial, institutional, it does increase people's vulnerability to burnout. The lack of reward devalues both the work and the worker, and it's just closely associated with the feelings of inefficacy. Of course, we can't omit and we can't deny how important it is to focus on the community and the surrounding that we're in. Okay, so in communities where there's a toxic environment, where there's definitely devaluing of the person's work, or there's a lack of relationships among the people you work with, that also put you at burnout. And the next point I wanted to also mention, and it is also related to relationships in the work, is that the fairness, okay, in that work environment, whether you are being treated fairly or not, and even the decisions that are being made, do you feel that you have some control, or even if they are made, do you feel that they are considered fair or not? Cynicism, anger, and hostility are usually the main emotions to arise when people feel they're not being treated with appropriate respect or fairness. The last one is values. Okay, and values is usually the ideals and the motivation that originally attracted people to that job. So all of us, as for example doctors, went into the medical field because we have certain values of wanting to help people, wanting to put patients' needs sometimes before our needs. Okay, so this is one of the main motivational factors that keeps us engaged and interested in our work. However, when there is a conflict on the job and there's a gap between the individual and the organizational values, employees would find themselves making a trade-off between work they want to do and the work they have to do. And that leads definitely to greater burnout. And this is something we can't deny, especially when we are working in larger institutions. Okay, we know that it's not as simple as a one-man show or one decision. So therefore, sometimes we are in situations where we have to follow certain orders or decisions, and those to us would cause some conflict to our values. And when a person is in such a situation, or at least going through such a situation in a recurrent pattern, that puts them at a higher risk of being drained and being burnt out. What is the impact of burnout? So why is it important for us to look into it? Because we know that people who do experience burnout, they have an impact on their colleagues. So it's definitely not just affecting your patients, it's also affecting your colleagues who are with you. So it is literally contagious, and it can perpetuate itself through social interactions on the job. So when you're working with someone who is burnt out, there's a very high chance that you're also going to be affected, and therefore it does spread, let's say, among the team members, not just to the individual. It has a complex pattern and relationship, of course, with health. We know that if you're already in poor health, that probably would put you at the risk of burnout quickly, because you're already at risk of exhaustion and fatigue. And on the other hand, burnout also contributes to poor health disturbances. It's usually the symptoms of exhaustion that I was talking about earlier can include some physical symptoms like headaches, chronic fatigue, GI symptoms, muscle tension, high blood pressure, even flu-like symptoms, and of course sleep disturbances. We also know that evidence does prove that there is a link between burnout and specifically cardiovascular disease. Is it depression? And a lot of people might confuse the symptoms of burnout to depression. Now, it is definitely a question that's been studied, okay? However, research does demonstrate that the two constructs are distinct. Burnout is a job-related situation, specifically, as opposed to depression, which is more general and context-free. So this is very important to differentiate. You can develop depression in any context. However, burnout is very much related to your job. But there is a link. 90% of those who respond, there was a study done that found 90% of people who responded with severe burnout did have symptoms of a physical and mental disease, and definitely presented with a lot of depressive symptoms. And it also found that people who found that increases burnout predicted the increases of frequency of using antidepressant medication. So there is definitely a strong link. However, we need to be careful in labeling these two disorders, that they are two separate disorders, and let's say their symptomatology might overlap. However, the context that they happen in is quite distinct. So, as we said, it is not one disease, okay, but we said that the relationship, okay, between burnout and depression seems to be a very strong one. So just before I finish and conclude, I just wanted to go over the main points I discussed before I move on to my colleague, Dr. Ibrahim Al-Mazidi, who's currently a psychiatrist. assistant registrar psychiatrist working at the Kuwait Center for Mental Health. And he's going to be talking about the second part of my presentation, which is how to manage burnout and what are the right tips for us to use in such stressful times. But to recap and go over the main point I discussed, burnout is definitely something that is common among healthcare workers in general. Right now in the pandemic, this puts us at a higher risk due to the exceptional situations we're living. There are certain factors that do increase the risk of burnout, like, as I mentioned, the workload, the community you work in, the fairness, the values, how rewarded are you, and how much control do you have over your job. Once burnout is there and it's untreated, it does tend to have a negative impact on the individuals and those around them. It also does have a negative health consequences, whether mental and physical. We need to differentiate between burnout and other mental disorders like depression. And finally, it definitely should not be ignored, because we know that if it does get ignored, it has its consequences that are never only limited to the individual himself, but also with spread to those around him and also to the patients that we are taking care of. So I want to thank you for listening, and I hope this was a helpful presentation. I'll give the floor now to Dr. Brahim. If you can hear me, perfect. Okay, now I can see you. So yes, I will just mute my presentation, and please, the floor is yours. Thank you very much.
Thank you, Dr. Maryam, and thank you, Dr. Adla, الفرصة هذه إن إحنا نتكلم عن موضوع البرن اوت. Dr. Ibrahim معاكم, psychiatry resident, Kuwaiti board, and really I'm going to be completing sort of the talk that استاذتنا دكتورة مريم تكلمت عنه, and basing it on a study that was done in World Psychiatry 2016. So when we talk about prevention and management, we really be in context and understand that burnout is something that can't really be solved by just the physician. In a study that was done by Johns Hopkins University, they found out that 80% of the solution to burnout comes from management, and 20% lies on the individual. So it's important for us to be in context to try to understand. I'm going to use شوية بالعربي عشان نتكلم واقعيا عن الأشياء اللي الموظفين أو الأطباء بالكويت يواجهونها. So tying it into the causes that Dr. Maryam تكلمت عنها. Number one, when we talk about values, we have to ask ourselves this question. شو اللي خلاني أنا أدخل الطب في البداية؟ شو اللي خلاني أنا أختار التخصص هذا اللي أنا أشتغل فيه؟ What were the ideals and aspirations that I had اللي خلتني أروح وأشتغل بهالوظيفة هذه اللي هي وظيفة إنسانية فعلا اللي فيها human care, human contact. It's important for us to remember these goals and these values, because oftentimes إحنا عملنا كأطباء مطلوب منا نشتغل أكثر مما يعني يتم يندفع لنا, especially في حالات الأزمات. فمن المهم إن إحنا نتذكر الشيء هذا. شنو الفاليوز اللي قاعد تخلينا نشتغل كل يوم؟ ثاني شغلة دكتورة مريم ذكرت الورك باترنز والكمية العمل اللي أنا لازم أقوم فيه كل يوم. شلون ممكن أنا أغير العمل أو اللود اللي أنا قاعد يعطوني إياه كل يوم في الدوام؟ Well, number one, we have to learn what's expected from us and what isn't expected from us. في أشياء يمكن أنت قاعد تقوم فيها سواء كطبيب in any of the hierarchical places مو مطلوبة منك. So it's important to know that so that you can sort of sort out the workload مالك. شنو التاسكس اللي ممكن you delegate حق ناس ثانيين؟ وايد من الأحيان نشوف teams, one person is doing all the work. سواء كان one of the teams, one of the registrars or seniors or even consultants. All the workload is on them, and that's not really healthy. لازم يكون الشغل متوزع بطريقة شوية that makes sense. فإذا واحد كان رئيس وحدة ممكن يوزع المهام حق اللي تحته. And finally, إذا أنت من الجونيورز, هل في طريقة إنك تقدر تقعد تاخذ موعد من رئيس الوحدة مالتك؟ أو رئيس القسم وتقول له listen, I'm being given more than what I can give, and this is affecting not only me, it's affecting the amount of time and effort and care I give to my patients. And it happens. وياما سويناها. نروح حق رئيس الوحدة نقول له this needs to change وهذا, and they usually listen. عادة الخوف من أن الواحد يروح حق مدير في العمل أكبر من الواقع. فهذا رقم 2. رقم 3 هو الأوتونومي، أو مثل ما قالت الدكتورة مريم, how much control do I have on the kind of work that I'm doing. هل عندي do I have a say in the kind of work that I do. هذا السؤال أعتقد يعني يفرق من تيم لتيم ومن تخصص لتخصص. فمن المهم إن التيم كله يقعد ويتكلمون عن الموضوع. Is my boss willing to give me more control على deadlines أو على البروجكتس اللي أنا قاعد أسويها or tasks اللي مطلوبة مني. هل في flexibility بالموضوع هذا؟ رقم 4, شنو أنا قاعد أسوي برا الدوام؟ لما أطلع من الدوام وخلصت شغلي, is my life outside of الدوام? Is it just about work? a lot of يعني أخصائيين نفسيين يتكلمون عن diversification of your life outside of work. شنو قصدنا؟ قصدنا إن إحنا ما ننظر لنفسنا أني أنا فقط الطبيب الدكتور إبراهيم اللي أشتغل في الطب النفسي اللي هذه وظيفتي, that's it. I only identify by this. لاحظوا أن في correlation بين identifying solely by your job and by feeling burnt out and constantly being consumed by your role. remember, في activities إحنا ممكن نسويها برا الدوام. They will replenish the energy if we feel depleted. ففي عبارة وايد يقولونها, make sure it's something that you want to do outside of work, not something you think you should. The next point is, how can I maintain a healthy social network? ولازم الحين نفصل بين العلاقات الاجتماعية والعلاقات الاجتماعية اللي فعلا تكون healthy, صحية, اللي فيها mutual respect, mutual understanding. فهل أنا قاعد أنمي my social network؟ وايد من الأطباء خلال الأزمة هذه قاعد يعزلون نفسهم, قاعدين في دورهم, قاعد يعزلون نفسهم من أهلهم. it takes more effort إن الواحد يرفع التليفون ويسأل عن سواء كانوا أهله أو ربعه أو أي واحد كان عزيز عليه. صار الحين أصعب. It takes more effort, but it's worth the effort at the end of the day. So it's important in we invest the time in these social networks. الأشياء الثانية متعلقة بالنوم. Are you getting enough sleep؟ وايد من الأطباء الحين في التيمز وفي الكوفيد تيمز they're working extra shifts. دواماتهم الشيفتس مالتهم متخربطة شوي. فمن المهم إحنا نعرف إن كل إنسان requires تقريبا 7 إلى 9 ساعات باليوم إنه ينام. والنوم هذا لازم يكون good quality sleep. فجزء منها إن الواحد يلتزم بالsleep hygiene measures والأشياء هذه موجودة if you want to read further about them. فالأشياء هذه وايد مهمة including sleep ودايت. فهل أنا قاعد أكل صحي ولا كل يوم قاعد أطلب طلبات؟ هل أنا قاعد I'm diversifying؟ يعني a lot of الدراسات قاعد تثبت إن الدايت اللي هو الميديترينيان دايت اللي متعلق بالجرينز والفيجيتابلز والنتس والفروتس وتقلل كمية الريد ميتس وتقلل كل هالأشياء هذه they are actually they promote a better well-being, they prevent depression, they prevent حتى cognitive decline. فمن المهم ان احنا we sort of tackle الموضوع بطريقة أكثر شمولية or holistic. ثاني شيء, هل أنا قاعد أرد البيت and I'm just being absorbed by screen time? A lot of specialists they suggest in we have to decrease شوية the screen time من وقتنا. It's important to stay to be it's fine تبي تقعد 2-3 ساعات or even less على Netflix to watch your favorite show, it's fine. لكن هل I'm doing things that are off screen؟ هل أنا لما أقعد مع الشخص قدامي في البيت هل I'm having a real conversation معاه؟ The actual connection is important, وهذا بحد ذاته can prevent this feeling of burnout. how am I managing stress لما أنا أكون في stressful situation. كل واحد فينا ترى he will be in a stressful situation وإحنا ياما حاسين ب stressful situations حتى بالسايكايتري. وفي many coping techniques ممكن نسويها. في ناس يرتاحون من الستريس دايري، كل يوم قبل لا ينام يقعد ويكتب الأشياء that are worrying him. And in a way when you write it on paper لما تكتبه يخفف عبء الشيء هذا. So you write it down, the things that worry you and the things that you want to think about. وتقول أنا باكر راح أرد حق الليستة هذه وراح أشوف I'm going to work it out. بس الحين for tonight راح أعيش اللحظة هذه. في وايد meditations وexercises في ناس تسويها، مثل اليقظة الذهنية. وايد دراسات قاعدة تطلع عن المايندفولنس وقوة المايندفولنس. mindfulness في إنه يمنع الاكتئاب ويساعد إن الشخص they don't get pushed into depression as a result of this chronic burnout. المديتيشن، relaxation، حتى الصلوات والprayers. في ناس وايد يستفيدون من الشيء هذا، فمن المهم إن إحنا نعرف شلون نقدر نواكب الشيء هذا. Finally أنا بيتكلم عن الأشياء اللي ممكن يسوونها المدراء في الدوام، أو واحد كان رئيس وحدة أو كان سينيور في الدوام. في 4 أشياء سووها في أكثر من مستشفى في أمريكا، ولاحظوا أن it actually works with teamwork. أول شيء are you informing your team, keeping your team informed، ولا القرارات قاعد تنزل عليهم على قولتهم مثل الباراشوت. والله الموضوع هذا الحين هذا الشيء جديد راح ينطبق على الوحدة وبس خلاص كلنا قاعد نشتغل. لما you join التيم معك and you discuss with them and you tell them شنو رأيكم؟ هل تحسون أن هذا قرار زين؟ هل هذا راح يأثر على واحد منكم إذا هذا القرار احنا سويناه؟ keeping the team informed. Not only that, give opening opportunities for them أن يطورون من نفسهم. You have to realize أن كل واحد فيهم عنده كارير قاعد يحاول يشتغل وقاعد يحاول يطور من نفسه. The more you provide opportunities حق اللي معاك, the more they'll feel appreciated. راح يحسون أن لا, the work I'm doing is meaningful حتى لو كان a lot of workload. And finally, recognizing. يعني أعتقد هذه كلمة وايد محتاجينها، إن الشخص لما يشوفنا قاعدين نعطي أكثر من المطلوب منا يمسكنا ويقول لنا good job, you're doing a great job. أنا أثق فيك، أنا أدعمك ومشكور على أنك أعطيت أكثر من وقتك. Finally, أبي ألخص بشيء سووه مايو كلينيك. سووا شيء اسمه listen, act and develop strategy. وسألوا الفيزيشنز قال لهم what's your biggest problem at work. Not only تقولون what your biggest problem is, نبيكم أنتوا تحطون and you propose solutions to these problems. نبيكم أنتوا تحطون strategies for these problems. ونبيكم أنتوا you put these strategies into action. وإحنا راح نعطيكم opportunity أنكم تسوون الشيء هذا. These are all wonderful ways in which we tackle burnout. وحقيقة يعطيكم العافية على حسن استماعكم، وأتمنى أني ما كنت ضيف ثقيل عليكم. أنقل المايك للدكتور حسين.
يعطيك العافية دكتور إبراهيم، موضوع شيق صراحة. قبل لا أبدي بس اللكتشر مالتي، خليني أشوف بس أسوي شير. صوتي واضح؟ شوفني. يعطيك العافية دكتور إبراهيم، ويعطيك العافية دكتورة مريم، ويعطيكم العافية على هالويبينار. Today I will talk about the mental health and its association with COVID-19, or the implication of COVID-19 on mental health. المحاضرة راح تكون شغلة عامة، مو بس for healthcare providers، بس هم بعد for the general population. What kind of implication this outbreak had. So let's see. So this today's lecture we will talk about certain topics. أول شيء راح نتكلم عن why there is mental crisis or mental health crisis during the COVID-19 outbreak. How does the COVID-19 outbreak impact on our mental health? Also, are there any new onset of psychiatric disorders that will arise even after this outbreak, not just during the outbreak? And then we will talk about the impact on children, on older adults or the elderly, and the healthcare providers in general. And on each one, we will try to find some coping mechanism or coping techniques that you can use. Last but not least, we will talk about when to seek professional help. So also, literally the stigma behind the mental health providers. Many people, they don't seek help. So there are key points or there are red flags that when you have these red flags, you need to seek professional help. So first of all, we will talk why there is mental crisis or mental health crisis during COVID-19. There are certain things that happen during the outbreak, especially during the lockdown, that will be a rich soil to arise or to grow the mental health problems among the population. First of all, because of the total lockdown that we are having right now, there is lack of normal daily routine. This outbreak has stripped us from our normal routine, so it's difficult to adapt to it. And also afterward, we might return to our normal routine, or there will be different routine due to new guidelines and new regulation, which will again strip us from our current routine. So again, we need to adapt once more again. Also, there is unhealthy coping mechanism because many people they don't have the right tools or healthy way to cope with such a stress. Some people they might use substance. Some people they might lash on other people. For example, they use violence or aggression. So all these are unhealthy ways to cope with such outbreak. Also, because of the information that we have, that if you got this disease, it doesn't have cure. There's a high mortality rate. So all this, people might think that having the infection, it means that they will die eventually, which is not right, not correct. So worrying about being infected. Also, the future, we don't know what will happen in the future. The outbreak, when it will end, the lockdown, when it will end. So the unknown is always source of fear and anxiety to people. That is in our human nature. So if we understand what will go on, we will have no fear, or our anxiety will decrease. But because the unknown is there, it will be difficult on us. Also, we've seen on daily basis, huge companies, major companies, they go broke. Halas, they close down. So because of this, there is job loss and there is income insecurity. Because of this, many people will have a lot of stress in their lives, especially if they are the sole supporter for their family and losing their job and they don't have a secure income. It will be a problem, a major problem. And all of these will contribute of feeling lonely. I understand some people during the lockdown, they are locked down with their family members and maybe like it's a huge family, but still they feel lonely because they feel they're not supported. They feel that there is no hope and it's hopeless. It's the end of the line. So all this will increase the likelihood or increase the risk of having a mental health problem. So how does the outbreak affect our mental health? As we say, feeling lonely, feeling injustice. Why do I have this outbreak in my country? Why this is happening to me? If someone close one have the disease, why this one? All these feeling of hopeless and injustice will have a toll on us. Also, because the amount of information we have, especially us the healthcare providers, we are exposed daily on new regulations, new information, new articles. All this will make us feel being overwhelmed, and it will have a huge stress on us. All of this also will cause low self-esteem. We think that we cannot do anything. There is no hope and there's no solution. And because of that anxiety and fear, some people might use a way of expressing that fear through discrimination, which is a huge issue going on now these days. Discrimination against race, discrimination against nationalities, which is a wrong way or unhealthy way of expressing emotion, expressing feeling fear. Also, excessive worrying, which might raise issues like anxiety disorders or such. And also, because of this, stress, because of feeling afraid, because of anxiety, of anger, all this, some people may cope with it by lashing on other people. So we've seen that increased rate of household violence and aggression, which is a wrong way also of expressing feelings. And people might react in different way. They don't lash out, but they may be withdrawn. They may be total isolated, and also suicidal ideation. As I remember, there was a case of a patient who was admitted to a hospital because of suspicion of having COVID-19. So during doing the swab, the results were pending. He didn't know if he has the disease or not. But after a few hours from the swab, they found out that the patient committed suicide. And this because of the stress, the amount of stress, the amount of feeling anxious and fear. Anxiety is a strong feeling. So because of that, he committed suicide. And he didn't know even if he has the disease or not. So all of this will bring us to the next point. Are there new psychiatric disorders? Will there be a new onset if someone was healthy before, no psychiatric diseases? In the future, will that person have a psychiatric disorder? It is possible. So there are many disorders, but mainly some disorders as seen on the slide. It is a high possibility in the future we will see a lot of people who will have these disorders, one of them at least. So for example, the generalized anxiety disorder, which is feeling anxious and afraid and constant worrying about anything, not just a specific topic, but about anything, even small topics, something minimal that has no effect. The person might be worrying about that thing all day long. They cannot sleep because of excessive worrying. They cannot enjoy being relaxed. They cannot control their feeling. They cannot control their thinking. Also, because of the disease, they might have illness anxiety, which is a certain type of anxiety that is related to a disease, a specific disease. And we've seen patients, they might have common flu, they might have sinusitis, and they come to us thinking that they have the disease, that they have COVID-19, and they might seek different doctors. They go doctor shopping because they think that they have the disease. And also depression. Depression, as my colleagues talked about the burnout, it can be mixed between the feeling burnout and depression. And depression also a strong feeling, and sometimes they come with anxiety also. Because of the excessive cleaning, because of feeling that they need to wipe everything with alcohol, with hand sanitizers, clean everything, this might raise an issue of OCD in the future. Eating disorder is also a possibility. Now, eating disorder here can be a way of unhealthy coping mechanism. Now, unhealthy way of coping mechanism doesn't mean also always using tobacco, smoking tobacco or substance use, but also it can be behavioral, like eating disorder, like stress eating. So this, in the future, we might see people having this kind of disorder for example, as I said, stress eating or binge eating. So this might be an issue in the future. Last but not least, suicidal behavior, which is an extreme way or an extreme manner of expressing someone's emotion, but it is also a possibility. So all of this, does that mean we will have this? Is this not just possibility? Is this given, halas, at the end of this outbreak, we'll have this disorder? No. These only risks, these only just to give you an idea. If you don't take care of yourself, things might escalate and might go into a wrong way. However, there are some coping mechanisms that we might do during the outbreak, even after the outbreak, to de-stress and to cope with this pandemic that we are having. So according to the WHO and according to many guidelines and recommendations, there are certain coping mechanisms that we can use. First of all, have a routine. Now, what do we mean by having a routine? By having a routine, we mean not just going to work, come back, and that's it, but also waking up, bedtime, personal hygiene, having healthy meals. All these, they must have certain time during the day. Now, why is this? Why having a routine is important? Well, first of all, so we don't live in total chaos. We as a human, we need some kind of routine to organize our day and to feel that we are doing something for a reason. We're just not living for a living. It's not just surviving, but we want to enjoy our life. So having a routine might help us doing so. Also, because you have a routine will make you want to do something, you want to stay, and you want to تتوقع ان في شيء جاي لك وراح تسويه. So you want that, you want to do thing in your life. So it's not just work, waking up, the essential thing, but also exercises, time for work. There are many people who work at home, time for work, resting, and also doing things that you enjoy, hobbies. Resting might be different than doing your hobby. Doing your hobby meaning you do something for yourself. So you anchor yourself to reality that I'm doing this not for other people, but I'm doing this for myself. The second point is keep informed. Now, keep informed, take only the facts. Don't take opinions, but only facts, and only from official sources. Now, does that mean I should be informed all the time? No, you need to, the next point, minimize newsfeed. Now, you can have like 1 hour a day to be informed, to have all the information you need. You can have it like even throughout the week, once a week, 1 hour a week. You can do that. Even if you are in frontline, if you are a healthcare provider, and you need to be informed all the time, even though just have a specific time throughout the day that I need to be informed, specific information, and that's it. Now, minimizing the newsfeed, it's not just the information, the medical information or the news, but also social media, also screen time. Now, the next point is social contact, the physical contact. Now we try to isolate ourselves as much as possible, but also the social contact, meaning in digital ways, is important. Important to share our worries, our fears with our loved ones, with our families, just to share our moments, because living is not just physical contact, but also socially, even through digital means. Also, spirituality and relaxation techniques. Some people might use mindfulness. Some people might use exercises like yoga, like meditation. Others, they can use spirituality like praying or like reading Quran. So all these ways to relax and to connect in a spiritual way, and also to de-stress. Also, avoid unhealthy coping mechanism, as we said, either behavioral or either using substances or either lashing out on people. Now, this will bring us to the next point, which is avoid discrimination. It is unhealthy way. As we said, fear can be expressed sometimes in a way that we can harm other people. So please try to avoid it. So last but not least, keep in mind that this outbreak will end. There is an end. It's not something constant. It's something that will last lifelong, but there will be an end. We don't know when, but life will go back. So what about children? How are they affected? Are they affected? Yes, of course. Shutdown of school, separation from friends, all this will affect children. So children might not express their feelings and emotions into verbal way, but they might express it more in a behavioral manner. So they might be angry, agitated, they might talk back, they might be withdrawn and isolated. Unusual bedwetting. Now, bedwetting is a key point that you find in a child that there's something going wrong. So when you find this, it means that there is something going wrong. Talk to the child. Also, regression. Some kids, older kids, they might behave in a younger age, like a younger age. This regression also will give you an idea that there's something wrong. Also, suicidal ideation. Now, this is more common with older children, not younger ones, that they have suicidal ideation. They might necessarily act on it, but they might have it. So how do we help children during this pandemic? What can we do to help them? Well, as we said, routine. Have or maintain a family routine. Now, family routine is just not having meals as a family, but also activity as a family. I know as healthcare provider, it's difficult on us to have that, especially the working hours. It's different with the on-calls and all this. But also, even though, just have time with your child that you can share those moments. Have a family routine, even lunchtime, even dinner time, any meal. Just have that family routine. Also, keep contact socially through digital means. It's important. So the child will share their moments with their loved ones, with their friends, with their family members. Discuss with your child in an honest way. Talk about facts. Discuss why we are isolated. What is the importance of being socially isolated like this? What is going on? What is the coronavirus? But of course, use language that is appropriate to the child's age. Now, when you talk like that, focus on the positive, not just the total fact, but also in a positive way. Now, sometimes the child, they cannot express their emotions well, even when you talk to them, especially the younger children. So use other ways to express their emotions, like playing, drawing, any kind of activity that they can express their emotions and to understand what is going on. Now, children, they might not fully understand how they cope with this, so lead by example. Children will learn if they see you how you act during this pandemic. When they see that, they can react and they can understand what's going on, and they learn by watching you acting in this situation. So lead by example. Yourself, take care of yourself, so your child can take that they can take care of themselves. Now, balance between learning, playtime, screen time. I know during the pandemic it's difficult, and it is time to be lenient with the rules, and it's time to be lenient for having like screen time more than usual and all this. But also try to find that balance between screen time, between the off-screen activities, and between also educational purposes. There are other ways you can use. There are websites, free websites like Khan Academy, National Geographic, Oxford Owl. They can use entertaining ways, educational ways, and also it considered as activity. You can tell your child if, for example, they ask about something, for example, an animal, and they don't know what animal is that. You can tell them, okay, how about you prepare something for tonight or for tomorrow, like a poster, like a collage or whatever, or even a play. Do your research and you can sit with your child. You can have that family time and your child can learn from this. And also it is an activity that they can enjoy later. So all this, you can have three ideas in one. They can enjoy it as an activity and you can enjoy having time with your family, and also it is educational. Also, try to involve them in daily chores like cooking, cleaning, anything like this will be delightful for the children, and children like to share those moments with you. Now, younger children, younger than 6 years old, they are more entertained into repetitive activities like sorting in colors, sorting in shapes, and also anything with water. They enjoy doing that. Now, older older children, older than 6 years old, they love doing engaging activities and projects. As I said, you can give them like Lego, tell them, how about you do, for example, a house? How about you do a zoo? And they like to have this kind of a project and orientation and an objective orientation. They like to do that. So try these activities with your child. They might de-stress them. Just remember, children, they need to be loved. So give them your time. Give them your attention. Even if you have little time, just explain that to them that I don't have all the time, I have little time, but you know what? I will give you some of my time because I love you. How about older adults, elderly, how they are affected? Now, the elderly, they are already at higher risk of experiencing negative thoughts due to loneliness, and due to quarantine. This risk even increases more. And because of this, and because also of the information that they might receive, that elderly, the mortality rate of patients who have COVID-19 is higher among elderly. All this is a stressful, increases the stress on the elderly. So they might experience anxiety, depression, self-neglect. This might affect their cognitive function, and all this might affect their medical condition, and it might be worsened. So what can we do to help our elder? What can we do to help our fathers and mothers, our elder? What can we do? First of all, as we said, as always, routine. Have regular routine and schedule, eating, sleeping, personal activity, anything. Just keep that routine. Keep regular contact with them through digital means, if possible, even by the phone. Just keep regular contact. Share what they are. Share your day. Just let them talk about their fear and their worry, and try to rectify any misinformation that they have. Also, daily simple physical activities. It is important to have physical activities. I know during the corona crisis or the pandemic, some elderly, they might stay at home, they don't like to go out, they don't have this, so they will lose their mobility. To maintain their mobility, just let them have that physical activity even at home. Also, if you are a caregiver, try to have as much supply as possible of the medication, 1 month, 2 months, or even more. I know this is not an issue here, but even though try to keep a track of the supply. If the supply will finish of the medication, like 1, 2 weeks before, try to contact their treating doctor as soon as possible to have an appointment and have that supply stuck on, because you don't want that to go run away, and you don't want any complication, any medical complication will happen to the elderly. Okay, so healthcare provider. My colleagues talked about more of the burnout, but we would like to talk about more aspects, because we work in a different working hours now, and we work in a different routine. We might feel overwhelmed by the working hours, the type of work, the information that we receive. And all that, sometimes we feel we are unappreciated by our colleagues, by our superiors, even by the patient themselves. So all this will be stressful events and stressful factors on us. Also, sometimes some healthcare providers, they feel they are avoided by their loved ones, because the loved ones or their family, they think they will have the disease, they will be easily infected if they got close to the person who works in a hospital or in a frontliner. And because of this, we might feel lonely. The stigma and fear from healthcare providers by the community, the risk of burnout, feeling anxious and depressed. Also, some healthcare providers, they have unhealthy coping mechanisms. They can have the tobacco use, excessive tobacco use, some kind of addictive behavior. All this will have a toll on us. Also, because we work so hard and we work for so long, we might have lack of sleep, unhealthy diet, and we might not exercise. And sometimes we don't have the energy and we lose interest of exercising. All this will have toll on us. So what shall we do? How can we cope with a pandemic as healthcare providers? First of all, just remember, stress and any associating feeling that you have, this is not a reflection of your weakness or incompetence. This does not mean that you are incompetent. This does not mean that you are weak. This means that it is too much, and this stress is fine, is normal. What you are feeling is just the stress. What you are feeling is just the toll of the work. So try to communicate with your colleague, with your superior, with just a normal colleague. Try to talk with them. Try to support each other. Share your fears, share your worries, and try to find solutions. Also, regular contact with your loved ones. If you cannot contact with them on a physical way, contact with them through digital means. Now, also proper amount of sleeping hours. This is very, very important. And also healthy eating. You try as much as possible to have healthy meals. Regular exercises, if it's not possible to go outside, exercise at home. 10 minutes a day, 7 minutes, even 5 minutes a day is important. Avoid unhealthy coping mechanisms that we talked about. Also, limit the news feeds, the social media, and information. I know you, as a healthcare provider, you need to be informed all the time, but even though once a day for a limited amount of hours a day is enough, or even once a week is enough. Now, let's say you did all this and still you don't think that you're doing well and you need professional help. So there are points that if you have one of them, it means you need to seek professional help. Now, what are they? Let's summarize them in 5 points. So when your thoughts, emotions, or behaviors are out of control and affecting your life on a social aspect, on a professional aspect, if you think that you cannot cope with it, you cannot go and do your work as normal, you cannot socialize with your family members, it's affecting your life, it means you need professional help. Sometimes you struggle to deal with these challenges and you cannot handle them very well. You do not know what to do with them. They're not affecting your life per se, but you are struggling with them. Then seek professional help. Also, When unhealthy coping mechanism, as we say, like tobacco use or substance or eating behavior, they become they interfere in your life. It means that there is a problem and you need to seek professional help. Sometimes the problem you are having is not affecting your life, but you feel you are confused, distressed by those emotions, and you need another perspective from an unbiased person. Then seek the professional help to help you with that. Lastly, sometimes, unfortunately, you might feel hopeless. Life is not worth living for, and the only way to end it is by ending your life. Now, if you feel this, this is not a solution. This is a crying for help. Now you are in a situation that you feel you are not thinking in a proper way, you cannot take the decision of doing so. Then seek help. This is not a solution. Thank you very much. I hope this lecture was helpful. And thank you, everyone from the speakers. Thank you for having me doing this lecture. Last but not least, please take care of yourself and stay safe.
Thank you, Dr. Hussein. يعطيكم العافية. Dr. Ibrahim, for both of you, amazing presentations, very informative, and this webinar definitely is a very important and unique, because it talks about something that we're all at risk of, whether even us in the mental health profession, we're not immune from burnout or even from getting affected psychologically. So this was a very informative, I think, and useful webinar in the right timing and in the right setting. Thank you very much again. أشكر الدكتورة عادلة البابطين على استضافتنا ويعني أعطتنا الفرصة أن نتكلم اليوم، وإن شاء الله هذه مو أول ولا آخر مرة يكون في participation مع الوزارة في أي مشروع أو أي برنامج للتوعية، whether it was related to doctors or related to the public. شكرا ويعطيكم ألف عافية.